you do log into Clarity, this is our new shiny system. This is our homepage. So most of your work is going to begin in Clarity within this homepage. And so there's a couple of places I want to orient us to in this homepage. This is where you will look up clients that are existing HMIS clients to add data for them and roll them into your programs. This is where you will also add brand new clients to the system for the first time. So there's a couple of places we want to orient you to. So one is in the top left-hand corner where mine says Sunrise. This is where you'll see your agency name that you work with. And if you do work with multiple agencies that use HMIS, we can assign those for you. Next place I want to orient us to is in the top right-hand corner, this button that says search. So this is your friend, search in Clarity equals home. Search equals home. So anytime you're wanting to come back to this home screen, that is what we want to click, is the search button. Next place I'm going to orient us to is this caseload tab in the top right-hand corner next to the search button. So I'm going to click on caseload. And first thing you're going to see in that caseload tab, after you click on it to the right of your search button, is you're going to see your active caseload. So this will automatically appear for you in Clarity once you enroll a client into a program. You'll see those clients listed under your active caseload. Next to active caseload, I'm going to click on this status due button. And so this is another place where if you all do complete annual assessments, it's only if you serve clients for a year longer. This is another place where you would see that annual assessments are due in addition to alerts across the system. Yes. All right. So I'm going to go back to the search button. So once you log into Clarity, it's going to take you to this homepage. And this is where most of your work is going to begin in Clarity. So this is where you would look up existing clients to add data for them and enroll them into your programs. And this is also where you would add new clients to Clarity for the first time. Up in the top left-hand corner, you're going to see your agency name, the agency that you work with. Next, this search button, this is what equals home. So this is always going to take you back to this homepage. All right, we good? Are y'all good over there? Yeah, okay. All right, so next piece that I touched on is this caseload tab. So if you're following along, we're in this search button here, and then we have this caseload right next to it. And if you click on that, it's going to show your active caseload once you enroll clients into your programs. Status due tab, this is just going to show you if you do have any like annual assessments, things like that that are coming up due for your clients. And then this case manager tab, this is where you would see referrals to your program. All right, so I'm going to click back on the search button. The next icon I'm going to orient you all to is this launch pad. So it's this icon up in the top right-hand corner with these little boxes. So this is called your launch pad, or if you're a breakfast fan, you can call this your waffle. So I'm going to click on this, and you're only going to see the icons here that you need for your role. So I have more icons than you'll see. That's all good. It's okay. You'll probably see reports and calendar on your end. So we're going to cover those in the training a little later. Also, a different feature that Clarity has is this little envelope icon. So I'm just going to show you how that works real quick. So if we click on this envelope in the top right-hand corner, this is where you can send direct messages that are secure to other Clarity users. So this is another way to communicate with staff within Clarity. So it's kind of like IM for Clarity. So we can click new message in this top right-hand corner. And then you can select the agency that the staff works at, select the receiver of the message, and then you can write in a message here. Probably something related to like coordinating services for clients, but I'm putting you rock. Oh, yay, it's you. Okay, cool. Yay, Abby rocks. Okay, so then I'm going to click back on the search button. So again, search equals home. I'm going to say that a lot during this training. So we're in this little message icon, just showing how you can send messages to each other. I'm going to click on the search button, and that's going to take us back to this home screen. You're always going to be able to see your recent client searches here. So if you did search for a client recently or you work with a client pretty often, they'll typically appear in your recent client searches, and you could just click on their name from there. First, I'm going to show you all how to search for an existing client in Clarity, but for the sake of this training, especially this training being geared towards street outreach staff, we're going to create brand new clients for the sake of this training. Also, if we use one client for all 100 of us, it would get really wonky and the system would like freak out. All right, so for searching for clients within Clarity, it's always recommended to search the first 3 letters of the client's first name and the first 3 letters of the client's last name. So I know that Shrek is in Clarity, so I'm going to type in SHROGR, and then he's going to pop up here. And if this was our client, we're not going to click on him right now. But if this was our client, we would just check his date of birth and social to make sure that he's our client. And then we could click on his name to pull us into his existing profile. Also in Clarity, yeah, really obvious if they have an ROI signed. You can see this just even when you're searching for the client, it will say yes or no under the ROI. So that's pretty nice. All right, so this is where I'm going to invite you all to create your first Clarity test client. And we are going to create 2 clients back to back. That's going to help us when we get to households in a second. So for creating your first client in Clarity, this can be anyone that you all want. So this can be your favorite celebrity, favorite pop star, your neighbor's name, your pet's name. It doesn't matter. It can be anyone. I have a niece who's really into Mickey Mouse, so that's what I'm going to use as my test client. So I'm going to type in Mickey Mouse, and then I'm going to click search so no one shows up. So on your all's end, you will choose your name that you want to use for your test client today, and then type in their first and last name, click search, and no one is going to appear. So then we'll click add client in that top right-hand corner. But I'm going to give everyone a little bit to think of a test client. Okay, so once you have your test client, just click add client in that right-hand corner. And this is going to pull you into the client's profile where it's going to prompt you to enter all of the client's personal identifying info in line with HUD standards. So this is all the same information we collect for clients' profiles and community services. So we're going to do this for this first client, and then we'll create a second client right after this. So I'm going to enter a fake social. And then under quality of social security number, this is the same drop downs you would see in community services for data quality. So you have full, partial, client doesn't know, client prefers not to answer, and then data not collected. So just like with our past system, whenever we ask the client the question, they answer that, we ideally want to select the full data. If a client doesn't know the answer to a question, we can select client doesn't know, or if a client prefers not to answer a question, we would answer it that way. We really want to stay away from data not collected. This indicates basically that we didn't ask the client the question, so we want to stay away from that when we can. And if you are working with any clients that don't have a social, it's best to select client doesn't know. All right. So now I'm going to enter a name here, a last name, Mouse, Mickey. And then quality of name, I'm going to click that drop down and select full name reported. For quality of date of birth, we'll select full date of birth. And then I'm going to enter a fake date of birth here. If they do have a middle name, you can fill that out or you can leave it blank. And then for the gender field, we would ask the client what gender they identify with. We'll enter race ethnicity information. And if the client's race ethnicity isn't captured in these options, there's also a blank where you can write in more information. And then veteran status, we'd ask the client if they've ever served in the US military, yes or no. I'm going to select no. Once you have all of these fields completed, we'll click add record in the bottom left-hand corner. And we're going to see right up at the top, it's telling us our release of information is missing for this client. So yeah, this system makes it really obvious when you need to complete those, which is great. I'm going to pause for a second, and then we're going to go ahead and we're going to create a second test client, and that's really going to help us in a moment when we get to households. You all will see that it makes it a lot easier. So can everyone give me a thumbs up if you've made your first client? Okay, awesome, sweet. And then yeah, if people have, yes, question.
So if somebody doesn't want to give you their social and
Mhm.
doesn't want to report it, you still put something in there.
Mm,
Zeros that we put in, or
typically, we don't want to put zeros. She's saying it won't let her save without putting a social in. Let's see.
For quality of social security number, if you put something for that, will it let you?
no, that's why I'm saying it.
Like, put something. Okay, we'll take that back to business.
Yeah, because typically, so this is a great question here. She was saying that if you don't put anything in the social security number field, it was not letting her continue. We really want to avoid like putting all zeros just for data purposes, because that's going to appear like it is the client's social security number. So we're going to bring that to our vendor because we should have the ability to save without it. Yes, question.
Also, I tried putting in a fake social security number of like 1, 2, 3, 4, 5, 6, 7, 8, 9. And it like instead of like letting me create one, it like led me to a profile with that exact serial social security number.
Oh yeah.
I was wondering, like, when we start, like, putting in like actual clients into Clarity, will it erase all the test ones so that way it's not two social security numbers?
Oh yeah, so this is all just like a totally separate site. So once you're in the live site, that's only client information. Yeah, so just so you'll know, this is our training site. So this mirrors our live Clarity site. They look exactly the same, but this is all just fake client information. It's just for practice. And you all are like the second group of people to use Clarity. So, you know, there might be someone who created the same test client as you, perhaps, or enters a similar social. But anyways, yeah, so this is just all for practice, and you really can't do anything wrong in here. So this is great to practice even after this training. All right, so now what I want us all to do is click back on the search button. Search equals home. So once you create this first client, we're going to click search in the top right-hand corner, and you're going to create basically a partner to the client you just created. So this is a client that later is going to go in that client's household. So just create another imaginary character that you want to be the partner of your first client. So I'm going to choose Minnie Mouse. And you'll just do this the same way. So I'm going to type in, oh, well, there's a Minnie Mouse in here. Okay, let me choose another Looney Tunes character. Okay, maybe Betty Boop. Mickey Mouse is going to be married to Betty Boop. Okay. Oh, she's in here too. Wow. Are y'all like reading my mind in here? I'm not going to say the next name out loud. Oh, gosh.
Randy, is the release of information,
Yes.
is the release of information always a hard copy that we upload?
No, so we'll get to the release in a second, and I'll show you that there's a way that for clarity that you can just electronically sign it for clients, or clients will sign it. So I'll show you that in a second. Okay, so once you entered your second client's name in the search field, it's going to take you to the page to enter that same information you did for your first client that you created. So we're just going to enter that information one more time for our second client. Yes, yes, you would select add client again. Sorry about that. And I'm not going to talk through this part because we just did it. So All right, and then once you enter that basic identifying info for your second test client, once this is completed, you'll click add record in the bottom left. And then we're just going to continue forward with that second client that we created. So I'll give everyone a moment to make sure you have that basic info completed for the second client. And we're getting close to a break in a moment. We're going to create an enrollment in a little bit, and then we'll do that. Yes.
Random question about the caseload section.
Uh-huh.
So like when you said you can do like see the referrals to your programs,
Mhm.
is there like, is it like a referral to the entire organization, or is there parts for like specific departments within the organization?
It should be, I think it's specific to your organization, but also I think right now we're mainly using that for like housing referrals through coordinated entry. So it might not be like specific to street outreach,
Okay.
but I'll bring the question to my team.
Okay.
We got another good question up here just while we're waiting for folks to get to where I am, which is for the caseloads, whenever they have the referrals within that caseload tab, is it a referral to the organization as a whole or a referral to the specific staff that's working with them? Do y'all know? The latter, the organization. No, to them directly. Okay, yeah. So in your caseload, we covered that a little bit ago. Whenever it's a referral specifically to you, to the person working with them. Just wanted to let y'all know that. All right, everyone give me a thumbs up if you're where I'm at. Okay, awesome. Thanks, y'all. Okay, so this is the client profile tab. And so first we see that basic identifying info that we just entered for the client. Within this client profile, you're also going to see the unique identifier, which is the client's HMIS number there underneath the photo section. And then also this is where you can upload a photo for the client. So you can click on this little photo icon, and this is where you would upload the client's photo. Next, there are these three icons that you'll see within the client profile. So you're going to have client privacy, this privacy shield icon, which we're going to cover in a second. And then also your calendar for the client and client reports. So we're going to cover each of those in this training today. But the first place we want to touch on is the client privacy. So this is this client shield. So this is where we would upload the release of information for our clients. And this is also where you can check and see if the client has an ROI uploaded for them already. You'll also see this banner across the top if the client's missing an ROI, which is awesome because it makes it really obvious for you. And you can also upload the ROI by clicking manage. But we're going to click on this privacy shield within our client's profile tab. So if you hover over that shield, it will say client privacy. We're going to click on that shield. And up at the top, you're going to see public and private for the client. This is where if you are the agency that created this client, you can change their privacy settings to private. Typically, as a community, we're going to want to keep most clients as public so that other organizations can view their profile and coordinate services for them. And then we're going to see our release of information section. So this is where we're going to upload our release of information for our test client. So we're going to click add release of information in that right-hand corner. I'm going to click on that. And then we're going to say that this client is cool with having their information in Clarity. So we're going to keep that permission as yes. You're going to have your start date there, and it automatically puts an end date for you. So you don't have to add 7. Yeah, y'all don't have to add anything in the system, which I love because I hate math. All right, so then documentation, we're going to click on this drop down, and we're going to see where you can have clients complete the release of information electronically. I'm going to show you what this looks like. You also still have the option to select attach PDF and upload a physical ROI document. But I'm going to click on this drop down, and we are going to click on electronic signature from this drop down. And then we're going to click e-sign document. All right, so then we'll see our release of information here. It's going to have all the same information as the physical ROI. So this is, if you are completing the ROI with the client this way, you'll want to make sure and hand your device to the client so that the client is completing this. So we're going to say they're cool with having their information in Clarity. So we'll select that. We'll scroll down. will say yes, they're okay with us talking about their case outside of HMIS. And then I'll put a signature in here. This is where the client would sign, and we'll click apply. And then you'll have your witness signature. So this is where you would sign and then click apply. And then we'll just scroll down and click save in the bottom. And you'll also want to make sure after you save that you also click save changes. Yes.
We just want to mention something that we discovered in our last meeting, the permission there at the top. Even if the client does select no within the ROI, you do need to select yes up there at the top regardless. This is something within the back end of the system that we cannot change. If you do select no, and some of you may have done that just to play around with it, it won't allow you to move forward in the ROI. So what their release of information is implying is something different than what our release of information is for. So just always yes for permission, even if the client is selecting no within our release of information.
Sweet, thanks, Whitney. So now we have our ROI completed. So next we're going to click back to the client profile. So that's your furthest tab on the left at the top that says profile. We're going to click back there. All right, and next we're going to go through how to create a household. So for those of you that are working mostly with individual clients, you all do not really need to worry about households. But if you all are typically working with families, you're working with partners or with dependents, then households becomes really important. So basically what a household does is it allows you to create group enrollments for clients and also allows you to provide group services. So you'll want to add a client to another client's household if they are interested in receiving services and or housing together. If you are working with an individual client, you don't need to worry about a household. But if you are working with a group of clients that want to receive services through your program together, we'll want to make sure and add them to the household. That's always your first step with that. So we created a partner for this client earlier. So we're going to make sure and add that client to this household. We're going to say that those two clients we created, they want to be enrolled in the program together, receive services. So your household and community service, it was like a separate tab that was labeled households. In Clarity, your household creation and editing that household lives within the profile. So if you look on your right-hand side, you'll see household members. To add our client to the household, we want to click this button that says manage. So we're going to click manage next to household members. And this is why it was really helpful to go ahead and create that client initially. We're going to see the client we just added under recent client searches, or you can search for the client you created earlier in the search bar. So in Clarity, it's really recommended when you're creating households to first create all the clients that you're needing to add to the household, and that will save you time in the long run. So I'm going to add Mickey Mouse to this household. We're doing a little Mickey Mouse SpongeBob SquarePants crossover. So we're going to add Mickey Mouse here. So you'll add the client you created. So you'll do that by clicking the plus sign next to the client's name under client searches or searching for that client in the search bar there. So I'm going to click on this plus sign. Then it's going to ask you for the member type. So I'm going to click on that drop down and I'm going to say significant other. And you're going to have the date that they joined the household. We're going to say that's happening today. And then we'll click save. So now under household members, you'll see your household is created. And this asterisk, if you hover over this indicates head of household. And if you ever need to edit a member of the household, if you need to remove them or change their relationship or change who the head of household is, if you hover over that member, you'll see a pencil and you can change it that way. So we see that the relationship isn't set for our head of household. So I'm going to click on the pencil next to our head of household. And next to member type, I'm going to put the relationship. So I'm going to say this is significant other as well. And then if you do see that if you needed to remove someone from the household, you could just toggle on exited household and that would remove them. So this system should be a lot easier too for creating households and editing. I will say, if you do try to remove your head of household, the system will prompt you to designate a new head of household first. So it's typically always best to exit the person that's not your head of household. So I'm going to click save here. Yes, question?
So with your example, it's easy to use significant other as the thing, but if it's, for example, if you're adding to the wife and I ask you to pick is the wife the person that you're adding or the person that's already there? You know what I'm saying? Like, are you choosing the household member that you're adding to their profile, or is it when it says which household member, or is it the person that you're creating right then? Is that who you choose?
Yeah, that's a good question. I think typically the best way to navigate households and creating them is to just always be like in your head of households profile and then adding additional members to it. And you're just adding their relationship to the head of household.
Okay.
Yeah, that's always the easiest way to do it. Yes, question.
Are you able to use the HMIS number in the search bar, search for a client?
That is a good question. Yes. Thank you. Yeah, so she asked in the search bar if you can use the client's HMIS number instead of their name, and you can. Okay, so now we have our household created. So next, before we get into the enrollment, I'm just going to show you all the history tab. But I'm just wanting to make sure I'm not leaving anyone behind. Does everyone want to give me a little thumbs up if you're with me? Amazing. Okay, so we're in the profile tab. We're going to click on this history tab up at the top. So it's just your next tab over. And I'm just going to show you this. This is going to grow throughout the training. But this history tab is where you can see a lot of information for your clients once they have been in the homeless response system for a little bit and have some of these fields. So this is where you'll see services that have been provided to the client, referrals, program enrollments, etc. So since we just created this client, they don't have any history, right? But as we start adding things for this client, this will grow. So we'll come back to this tab a little later. It's really nice because once the client does have history, it is color coded at the bottom. So there's a little key, so it makes it easy to see what you're looking at. And if we click on this drop down next to view, once the client does have history, you can select categories and you can search for specific pieces of the client's history. So I just wanted to show you all that. So next, we're going to go ahead and create a program enrollment for the client. So to create your program enrollment, we're going to click on this programs tab. And something that really sets you all as street outreach providers, this is a street outreach geared training, apart from other providers, is that for you all, whenever you have your first interaction with a client, we want to go ahead and create a program enrollment for them. Even if you don't know a lot of information about the client at that point, and you don't know for sure you're going to be serving this client on an ongoing basis, specifically for street outreach, first thing, we want to go ahead and create a program enrollment. And basically, you'll just enter what you know at that point. So let's say, I'm working with Sandy Squarepants, made up fictional person. So I'm working with Sandy Squarepants, and maybe I just had my first interaction with her. And maybe it was a pretty brief conversation. I don't know that she's interested in engaging in services on an ongoing basis, but I do know that she's experiencing homelessness, and we had a street outreach interaction. So I'm in this programs tab. And next, what we want to do is you're going to see the programs available to enroll the clients in. And so you're going to want to check and make sure you're enrolling the client in your program. So this is really crucial. If you're unsure about which program to enroll a client into, make sure and ask your program manager and make sure you're enrolling them in the correct program. So I am going to enroll this client in a street outreach program for this training because, this is street outreach geared. So I'm going to enroll this client in Sunrise Mobile. So basically on your end, from the programs available, select your program. Ideally, it's street outreach. And so we're going to click on this drop down for that program. If there are any other active clients, you'll see that. You'll also see any service categories, if that applies, associated with this program. And then you'll also see included group members. So this is where you can create those group enrollments. So if I left Mickey Mouse toggled off, he would not be pulled into the enrollment. I'm going to go ahead and toggle him on so that he is included in this enrollment, just to show you what a household enrollment looks like. So I just clicked on the program enrollment dropdown. I toggled on the group member, and now I'm going to click enroll in the bottom right-hand corner. So I'm going to select enroll here. And so, like I said, for this example, we're going to say we don't really know a ton of information about this client yet at this point. So we're only going to complete what we know. So I'm going to say that we know that we interacted with this client today, August 19th. And I'm going to say next to translation assistance, they do not need translation assistance. So I'm going to select no. This is our head of household, so I'm going to leave that as is. This date of engagement field, we're going to leave this blank. Your date of engagement field for street outreach projects is super important, but that is the date in which you know that you're going to be working with the client on an ongoing basis, most likely, and they're interested in engaging in services through your program. So that's when we enter date of engagement. So we're going to skip that for now because we don't know a ton about this client yet. So let's say we also know that this client has a disability. So we're just going to scroll down to disabling condition and select yes. And then let's say we know that the disability that this client has, that they have a mental health issue. So we're going to click yes. And then next to long-term, we'll click yes. And once you actually complete the full enrollment, usually we like to go through each of the disabilities to make sure we don't miss anything the client has. But let's say that that's all we know for the client. So y'all just filled out a couple fields. Doesn't really matter a ton which ones you filled out. We're going to say that's all we know at this point. So we're going to scroll down and click save and next. All right. So those were saved. So let's make sure this program is saved. We've been working this out on our end to make sure that you all can add it.
It won't let me save unless I choose an answer. Everything's free.
Okay. Well, so that will work for all on the live site, but we're still trying to figure this out on the training site. So basically, if it doesn't let you save, just open it back up. We're going to complete the full entry now. But yeah, in the live site, we should have it set up where you can save without having all of the information filled out, specifically for street outreach. Haley, did you have something?
Yeah, they can only enroll clients in programs that are under their own agency.
Uh-huh.
So like you're doing Sunrise.
Yeah.
So does everybody have programs?
They should be enrolling in their own programs tied to their agency.
Can you raise your hand if you don't have a program? Okay,
Okay. All right, y'all. So that will work in the live side. Sorry, training snafu. Okay, so click back. What we need to do now, we're going to say that we met with this client again like 2 weeks later. And let's say at that point, we know that the client's interested in receiving services through our program. They're engaging in services. At that point, you all, really important to enter that date of engagement. For street outreach programs, that's when all your data matters. That date of engagement, once that's entered, that's the point where the entire enrollment should be completed. Does that make sense to everyone? Okay, cool. So we're going to navigate back to that program enrollment. Yeah, so the date of engagement, it means that you are receiving, the client is interested in receiving services on an ongoing basis and is interested in engaging services with your program.
So that date comes into play like as soon as they're wanting to do a CA.
Yes, I'd say so. Yeah. Okay, cool. So we're under Sunrise Mobile. Yes.
Just to confirm, this is strictly for street outreach because.
Yeah, so if y'all are in this training, but you're not specifically street outreach, you won't have that field, and that's okay. Yeah. All right. Yes.
So I'm help me understand. So you say we only put the date of engagement in if we are doing like CAs and stuff with them?
No, these are good questions. So you'll only enter date of engagement if you're working like in a street outreach project.
Oh, okay.
Yeah. So it's not connected to coordinated assessment. They don't have those fields. It's just for street outreach. Yeah, that's a great question. Y'all, questions are good.
Okay.
Yeah.
Okay, so let's say I go into an encampment, right?
Mm-hmm.
And we're passing out hygiene.
Mm-hmm.
That's the data engagement, right?
So that would be where you'd want to create the enrollment just with what you know about the client, but I wouldn't create a date of engagement at that point because it's more like whenever you have more of an in-depth conversation with the client and they're like wanting to engage in services like on an ongoing basis, like with your program. So I would just kind of create your enrollment at that point and enter what you know to be true. And then once you're like meet with the client and you're able to like complete the full enrollment, that's when you would enter the date of engagement. Does that make sense?
Well, normally the day that I engage, like if I
Mhm.
go into an encampment that day, I'm gonna get all the information that day. I'm gonna
Okay,
get it.
yeah, then you can do it at that point. Yeah, so it kind of varies. And if you're ever like confused about when you should do it, you can always reach out to us or to like your manager or something like that. But yeah, so yes, got a question?
I guess, I just want to make sure I'm thinking about it correctly. So
Mhm.
the way that I would think about it is like, if we need somebody, we just want to get their information into the system, but they might not have said that they were interested in services at that time.
Mhm.
But then when they do say that they're interested in services,
Mhm.
potentially later on, that's when
Right.
the engagement would be.
Yeah, exactly. Yes.
So I just had a question, something that came up in one of our meetings about the HMIS consent. So during the blackout period, are we still able to use the hard copy? And that would be sufficient because it doesn't look like anything has changed
Mhm.
the previous platform to Clarity.
Yes, yeah, you could complete the ROI and then upload it once we go live. So she asked the question of kind of in our blackout period, if we can use the paper ROIs and then upload them to Clarity once we go live. So yes, you can absolutely do that. Yes, question?
Just to kind of go with that hypothetical, like entering a campsite, like providing hygiene, like say a client doesn't really express interest in services. I do an enrollment, I don't do a date of engagement.
Right.
Is it okay for them to never have a date of engagement?
Yes.
Okay,
Yeah.
great.
Yeah. So for street outreach, you might have clients where you have like a very minimal interaction with them. This example was maybe you're just giving them like a hygiene kit, and then maybe you never interact with that client again. That's okay. Especially with Clarity, we have the ability to auto exit clients after 90 days of no interaction. And we're going to be turning that on for street outreach specifically. So if there is no interaction again with that client, the system will catch that for us and will auto exit them, which is awesome. Because in our last system, we just had to catch that on our own. So yes.
Is that 90 days of no interaction in this specific program, or is it 90 days interaction just
With this program.
With anything, but it will specifically.
All right. Cool. So we're going to go ahead and create our full program enrollment now. And then after we get through this, we'll take a break.
Randy, we have a couple more questions.
Okay. We'll take 2 more questions, and then we will have questions like an open floor for questions at the end too, just for time's sake. Yes. Other question?
I just am a little confused on, I'm still.
Okay. No, that's that. Thanks for letting me know. Yeah. So for date of engagement, whenever you all are street outreach providers, you have like an initial interaction with the client, like maybe you're only giving them like a hygiene kit, for example, and you don't really know a lot of information for that client. You also don't know if you're going to see them again through your street outreach program. You don't know for sure if they're interested in engaging with services on an ongoing basis. At that point, you would go ahead and create an enrollment in HMIS. The reason being, we just want to show that street outreach happened with that individual and just to connect them some way with our homeless response system. So at that point, you would just enter all you know, and maybe you only know that this person's name, and you only know that they're experiencing literal homelessness, they're staying outside. So you would just enter what you know and save and close it. Then let's say you see that client again 2 weeks later, the same client you gave that hygiene kit, you look them up, and maybe at that point you are sitting down and you're having a more in-depth conversation with them, and you know that you're going to be working with this client on an ongoing basis. They're interested in receiving services ongoing. That's the point whenever you would enter that date of engagement, because it's showing that it's going to be more of a long-term street outreach providing. And then you would enter the entire enrollment with them. So you would go through disabilities, income, non-cash benefits, you would collect all of that. And so basically that date of engagement, it's indicating in HMIS that you should be completing all of that HUD required information. Before the date of engagement, you're not required to. Does that make sense? Does that clarify a little bit? Okay.
All of the information.
Right. Right. Exactly. It's basically like when all the data, oh, sorry, go ahead.
If it's incomplete, you cannot do the data.
Right. Basically, yeah.
Thank you.
Yeah, good questions. Any other questions about this before we keep going? Yes.
If you never put
in for somebody,
Mm.
will they be kicked out after 90 days? Because there's no track for when they engage, right? You said you could turn
Yeah.
on automatic
Mhm.
disenrollment.
They should still be exited after 90 days of no interaction, even if they don't have a date of
So
engagement.
they're not looking at the date of engagement at the start of that 90 days.
Yeah.
That's the date that you put them in. And then
Right.
put them in your program.
Right.
Okay.
Yeah. Yes, one more question.
This might be random, but so if they're not working with anybody in that 90 days, which that may not really happen a lot of the time,
Mm-hmm.
that use the services,
Mm-hmm.
and they're exited, so would, then they wouldn't be in the system anymore, so we would need to create a new.
Yeah, that's a great question. So they would still be in the system. They would just be exited from that specific street outreach program where they didn't have any interactions. And if they do pop back up, like you see them again through your street outreach program, you can just create a new enrollment for them at that point, like once they're exited. But it's not going to, so basically the auto exit after 90 days, which it's just 90 days of no interaction through that street outreach program, they will still have an existing client profile. You'll still be able to look them up. You can add information in their profile. You can update contact info. They would just be exited from that specific street outreach program where there weren't any interactions with the client. And then if they do pop back up, just create a new enrollment for them. Yeah. Okay, cool. So we're going to create this program enrollment and then we're going to take a little break. And we'll have definitely more time for questions at the end, but these have been awesome questions. So thank y'all for asking them. Okay, so I'm back in my programs tab. If you kind of lost where I am, I'm in the programs tab for this client. Under programs available, I'm going to go ahead and select that same program that we just created partial entry for. It didn't save. That will be fixed in the live site. So under Sunrise Mobile, we're going to click on that on my end, but you'll select your specific program. And then I'm going to make sure, oh, that person says it is enrolled. Okay, I'm not on my head of household, so I'm going to switch to my head of household and then come back to this. So I'd also make sure you're on your head of household. Yes, we're going to enter the program enrollment through the person that is your head of household. Okay, it did save. Okay, actually it did work on my end, so you might just want to make sure you're under your head of household. That could be the reason. So that did work actually on my end. So yay, go Haley. All right, so I'm going to click on the pencil back into that program enrollment I just created, and we're going to fill this out completely. So you're going to want to make sure if it takes you to these tabs, you click on the enrollment. So is everyone in your enrollment? Yeah, okay, cool. So we're going to go through, we're going to answer all these questions. So now we're going to enter our date of engagement. After we enter this, we want to make sure and complete the full enrollment. And we're going to say that our date of engagement is a week after we initially met with the client. So I'm going to set this date of engagement as 8/26/2025. And now we're going to complete the full entry. So this next piece, this is asking for the prior living situation. So this is the piece where we're capturing the client's history of their homelessness, looking at the past 3-year period and seeing how many times the client experienced literal homelessness, so staying outside or in shelter and car, and how long each of those episodes lasted over the past 3 years. So that's what this prior living situation section is. And so typically how we'll want to complete this is you typically want to have like a piece of paper and a pen, and you'll kind of backtrack with the client over the past 3 years to make sure this is as accurate as possible. So in our learning management system, we have a defining chronic homelessness video that goes in depth. But for the sake of time today, we're going to say that this client has been staying outside for about a year. So that's what we'll enter here. So type of residence, this is where the client was staying right before you started working with them. So typically to get this question, we would ask, where did you sleep last night or where did you stay last night? So we're going to say this client has been staying outside. So I'm going to select place not meant for habitation. And then length of stay in prior living situation, we're going to say they've been staying outside for a year. So I'm going to select 1 year or longer. Approximate date this episode of homelessness started. This is not homelessness in general. This is the most recent episode. So we're going to say that this started, we'll say August 1st, 2024. And then number of times on the streets in emergency shelter or safe haven in the past 3 years. This is the number of episodes they've experienced. We're going to say this is 1 episode. and the total number of months homeless on the street in emergency shelter or safe haven in the past 3 years is more than 12 months. So once you have that history completed, we'll move down to the next part. So we had filled out some of this previously. So this is disabling conditions. So this is where we'd ask the client if you have a disability. And typically, if I'm not familiar with the client's case, I'll want to go through each of these disabilities to make sure that I don't miss anything they might have. So I'm going to ask if they have a physical disability. I'm going to say no. Ask if they have any developmental disabilities. I'll say no. Any chronic health conditions like high blood pressure, asthma, diabetes, I'm going to say no. We'll ask the client if they've had any diagnosis of HIV or AIDS. I'll say no. And then we said yes for mental health issues. So, we'd ask them, do you have any mental health issues like depression, anxiety, PTSD, etc. We'll ask them if they have any history of alcohol abuse or drug abuse. So I'm going to say no. And then next, this is where we get into the conditional logic. I'm excited to show you this. So this is where we would ask the client if they are a survivor of domestic violence. If we answer this question as no, it doesn't populate any other questions around that. If we were to ask this question of the client and they said yes, then it would ask, when did this last occur? And are you currently fleeing? Those questions. I'm going to say no, so those will disappear. Next, we're going to ask the client, do you receive income from any sources? I'm going to click on this drop down, and if I say no, that's it. That's all we have to enter. But I'm going to say that this client does have income, so I'm going to click yes, and then it's going to populate the HUD considered income sources. So I'm going to say that this client is receiving Social Security income, so I'm going to toggle that on, and then put the amount they're receiving in Social Security income every month. And then we'll scroll down, and next question we would ask is, are you receiving any non-cash benefits like SNAP or food stamps? So I'm going to click that drop down and select yes. It will appear all of the HUD considered non-cash benefit sources. So I'm going to toggle on SNAP. And then lastly, health insurance. We'll ask the client if they're covered by any health insurance. I'll select yes here. It'll populate all of the health insurance sources, and I'll just toggle on Medicaid. And then we would click save and close. If you do have your household in this member in this entry, it should move to the next program enrollment. All right. Yes.
Is there a place for map on here?
That's a good question. So we got a question about MAP. So if for those of you that aren't familiar, MAP is the medical access program. So it's kind of like a form of health insurance for clients that have like no income or low income. And so a lot of our clients receive MAP. So MAP is not considered a form of health insurance by HUD. So we would not enter that in the health insurance section. So what we would need to do on our end is we would need to add a question asking, are you covered by MAP? If that question is not on your enrollment, then we would not enter that anywhere in their enrollment. So instead, you could add that like in a case note or something like that. Yes.
I'm so sorry to dwell on this data engagement thing.
Yeah, no, it's good.
I also have, I don't know if everybody has this, I also have a status determination. Could you tell me what the difference would be between the date of engagement and the date of status determination? Because I think we're kind of talking about the date of engagement as being when the enrollment status is.
Yeah, I would think that would be like kind of the same date and similar, but team, do y'all know about that one?
Yeah, so the date of
Thank you.
status determination, you can put the date that you engage with them, and then it'll say were they enrolled or were they not. And so for us, if we weren't putting that going on, say they weren't enrolled, as long as they were enrolled. It's the same word enrollment, which makes it, but we can talk.
Okay, thanks. We're all sharing information and learning together. That's cool. Okay, so one more thing before we take a break. And so for street outreach providers, another piece that kind of is a separate data element from other program types, this is also just for street outreach staff, which is called the current living situation. So this is where you'll record basically any contacts you make with the client. And this is basically to show like where street outreach is happening in our city and how often that's happening with individuals in our homeless response system. So current living situation, every time you make contact with the client. So your current living situations in Clarity are going to live under this assessments tab. So we're in the enrollment here if you're on the same screen as me. And if you're not, you can just click on programs and you can find your enrollment. If you're on that screen, just stay there. But if you lost it, you're under programs, you would just click the pencil next to your enrollment and then click on assessments. And you're going to see current living situation there. So we met with this client for our first interaction with them. So we want to click start next to current living situation. And then you'll click add current living situation. And all you need to put here is the client's current living situation. So if they're living outside, we would put place not meant for habitation. And then location details, you would just put the zip code roughly of where you're interacting with the client. Yeah, so you might not need it, but if you are working in street outreach, you should have it. So we can add it for you if you need it. Yeah. So then we'll click save and close. So we put our first current living situation in. We're going to add a second current living situation for this client for our hypothetical because we said we interacted with them a second time. That's when we completed the entry. So I'm just going to click back on assessments. I'm going to click start again next to current living situation. I'll click add current living situation. And then we'll just put that second one. So we said that happened August 26th. That's like when we put our date of engagement in and finish the enrollment. We'll say they're still staying outside, and then we'll put in the zip code where we interacted with them. And then we'll click save and close. So yeah, just key for street outreach, anytime you interact with a client, entering those current living situations. Okay, so now we're gonna take a break. We've been going for like over an hour. So we're gonna take like a 15-minute break. So let's just all come back at 11:30. Does that sound good to everyone? We have some snacks in the back if you want to grab a snack. And then the bathrooms are out this door. You'll go down the hall and you'll see signage for the bathrooms. So y'all are killing it. I know it's all new info.
Hey, Brandy, we can't hear you.
Okay, here we go. I'm unmuted. Sorry, those Zoom people couldn't hear me. Okay, so I'm clicking back on services, and we're going to go ahead and provide a test service for our clients. So under here, you might see different services than me. That's okay. We're just going to go through an example. So for this example for services, these are the CAP Metro passes. So this would only be if you're an organization that's collaborating with CAP Metro for their bus card program. So I'm just going to do an example of this. I'm going to say we're issuing this client a bus card. So on your end, you can just choose whatever service you see. We're just going to do a test example. So I'm going to click on that drop down. And then under service notes, this is where you can put the card number for the bus pass or the bus card. So I'm just going to put a number here that's random. And then we have the date that we issued it there. And then we just click submit in the bottom right-hand corner. So basically, you'll just select your service. You'll have the date you provided that service, and then you'll have any notes that are required. For this CAP Metro collaboration, it's specific. They want the bus card number and the service notes. So then we'll click submit in the bottom right-hand corner. And then it will say that that service was applied. Yes, and we're still kind of figuring out how we're going to do the workflow for that. But
I just noticed at the end, it wouldn't let you leave the end date blank.
Yeah.
oh, really? Okay. Yeah, so we might have to fix that for the live site. Okay. Yeah, we'll note that. Yeah, so team on the bus pass, you're not able to put like an end date for it. Just letting you know. Okay, so now we have our service entered. So that's just an example of how to enter services, and we'll add more of those. Programs, we just covered that. We're gonna move over to contact. So this contact tab on the top right hand, we're gonna click on that contact tab. This is where you'll enter your client's contact information. So this is really important, especially for you all as street outreach providers, to keep the client contact information up to date. Because if a client does come up for housing referrals, this is the first place that staff will look to get in contact with that client to notify them. So in community services, your contact information fields were on the client profile. In Clarity, it's a separate tab. So this is where we'll add client contact info. So I'm going to click add contact here. And then under client contact tab, we're going to be building this out a little bit where you can add under this dropdown, you'll see like family member, friend. That way you can add other contacts for the client if they do have a trusted family member or friend that you're able to reach out to. So we're going to add that. But for right now, we have the direct client contact info. So we'll select this contact tab type is for our client directly. So we would enter an email here. So I'm putting in bikinibottom@gmail.com for SpongeBob. And then I'm going to put in a fake phone number for the client. If they do have a secondary phone number, you can add a second phone number. And you'll have this toggle for active contact info. So you can always edit this contact info. So you can edit it and change the phone number. Or if it's just not an active contact, that would especially come into play if like a client did have a trusted family member, but maybe they don't have contact with that person anymore. You could toggle this off and it would not be an active contact for the client. But we're going to say this is their up-to-date contact info. So we'll also have the date that we entered this contact information. So we'll say we're entering it today, and then we'll enter a note. So in community services, we have separate fields for like preferred contacts. And so you would put that information in the notes tab for clarity. So maybe this client prefers to be contacted by phone. We can enter that here. And then another field that we did have for contacts is where does this client spend most of their time? So basically, if you're not able to contact the client by their preferred method of phone or email, you can type in this note where the client spends most of their time. So maybe if they go to Sunrise every Friday, typically at a certain time, we can put this in there. So hopefully staff can find the client to offer services if they can't get in touch with them by phone.
Question.
Yes. And I'm going to click save.
I noticed that when you save it, it does create, it has a created on date. So is there any instance where the contact date would be different, or is it just redundant?
No, I don't think so. I think that the purpose for that contact date is just to show like how dated that contact record is. So yeah, it would just be the date that you're entering the phone number. Yeah, that's a good question. So we'll click Save Changes, and then I'm going to click back on the Contact tab at the top. So now we can see the client contact information. You can add more contacts. If you did ever need to edit this, you could click on the pencil next to it, and this is how you can update the phone number, add additional information there. So now I'm going to click on Notes. So this is where you can add general client notes. So these would be notes that aren't necessarily tied to your program enrollment, but are maybe more like general client notes. So I'll click add note here. And then I'll title this, we'll say case management appointment. Under category, we'll add categories here perhaps, but we're going to put no category for now. We'll say we're entering this note today, and then you can just enter whatever your case note is. So I'm going to say, completed client enrollment. And then we can scroll down and click add record. All right, so I'm going to click back on the notes tab. And I also want to show you where we have public alerts. So we're still kind of figuring out how we want to use public alerts as a community, but public alerts is essentially something we can use for BOLO. So be on the lookout. So whenever we have clients that have come up for housing referrals, we're having trouble locating that client, we could put out a public alert across the system. So when staff log into Clarity, they're able to see that really clearly. So I'm going to add an alert for this client. So we're under public alerts within the notes tab. I'm going to select add alert in the right-hand corner of public alerts. And then let me title this. We can just say client has active rapid rehousing referral, for example. And then you can select an expiration date for this. Maybe we want this to expire in about 90 days. We can select that date. And then we can put in notes here. So maybe we put in, who the client needs to contact for this referral. So we can say, client, this client at this organization, and put their contact info. So then I'll click Save Changes. And now this client would have a public alert. All right, now I'm going to click on our Files tab. And this is where you can add general client files. So this would again be files that are not associated with a specific program enrollment, but are just kind of more general client files. So an example of this would be like clients identifying documents. So if you had like a copy of the client's ID card, a copy of their birth certificate, you can upload these under client files. So I can click Add File. And then you would click Select File and select the document that you scanned to your device. And you can choose a category for this. So we would select, personal identification, and then you can select the type of document it is, or select other if it's not listed here. So maybe we're uploading a copy of their ID card. We can select that and then select the file that we have scanned to our device. All right, so next tab we're going to get into is location. So I'm going to click on the location tab across the top. So this is different than, current living situation. This location field is really for you all as street outreach providers to know where your clients are located when you're out in the field. So we can click this Add Address button here. And you can select the address type. So maybe I come down and I select encampment. You can title this, and then we can click Add Location. And it should work, sorry. I think my system's being a little slow, so I might have to log back in. Okay, so you can enter the address specifically here in this address line, or you can use geolocation. So you can click on current location, and it should pull up where you're currently located. Like if you were out in the field at an encampment, you could select current location, and it would pinpoint this, and then we can click Add. And you can title this, I'll just call it encampment again. And if there was a second address, you could add that, and then putting in the date that you're adding this location. And you can toggle this on if this, this is the active location. Or again, just like with contact information, you can toggle that off, and you can put any notes associated here as well. And then we can scroll down and click Save Changes. So that's more just for you all as street outreach staff and being able to locate clients and provide services for them in the field. So next I'm going to click on the referrals tab. And so this is where we're still kind of figuring out again how we're going to use referrals for clarity, but this is where we would see typically like housing referrals for clients. All right. So now I'm going to click back on the profile tab, and just a couple more things I want to show you all before we get into basically what are called status assessment updates, which are similar to interim updates. So I just want to show you that in Clarity, you can add your client appointments within Clarity. So you have like a calendar feature. And so to get to where I'm at, if you kind of lost where I'm at, I just clicked back into the profile tab for the client. So it's just that first tab on the top. So right next to the privacy shield, you'll see this little calendar icon, and it says schedule appointment if you hover over it. So I'm going to click on this, and this is where you can add client appointments in Clarity. So let's say that we have a case management appointment scheduled with the client for the 27th. So we can put that date in. We can do a start time. Maybe it's 2 p.m. We'll say done, and then you can put your end time. Maybe that's 3 p.m. We can click done. You can put the location in. and then click save. Once you have that appointment scheduled, you can move up to that launch pad. You'll remember the launch pad from the very beginning, or your waffle. You can click on that, and then you would click on your calendar icon. So I'm just clicking on the waffle, click calendar, and then you'll see all of your client appointments there. So this is another way to track client appointments. You can also merge this calendar with your Outlook calendar, which honestly, our team hasn't played around with that too much, but you can click subscribe to iCalendar, click open, pick an app, and then you can select your Outlook app, and you should be able to merge those calendars together. So it's just another way to track client appointments. All right, so since I totally moved out of the profile, we're gonna have to click search again because search equals home. So we'll click on that, and then I'm just gonna navigate back to my head of households. So if you lost your head of household, just type in their name in the search bar, click search, they'll pop up and you can click on the pencil. Yeah, question?
So with the calendar, if they have a valid HMIS, like you said, then we could potentially add like a medical appointment in the calendar so that the community can see that. And other people, as long as there's view access, they can see that in the calendar.
That's a good question because I'm not positive about the visibility. So I don't know if like only you can see your calendar or if other staff can see your calendar. Do you know, Haley?
It's probably people within your agency. One of the things I saw in a bit of the documentation about this is they said you can use it to print your client, like your client's appointments. So if you want to, if they have 3 appointments coming up, you can enter them into the calendar, print it. Like that's one use case.
Yeah, so that was a really good question. The question asked, like, if the client signed their ROI and we have client appointments on our calendar, can other staff see like, oh, this client has a medical appointment coming up? Can they see that? So we're kind of all learning these things together. So we're gonna take note of this question and we'll let you all know. It might be locked down by just you or your agency, so we're gonna figure that out. Haley brought up a cool point that you can also like print this out. So if you wanted to like print out a copy of like the client's appointments with you, you could do that so that they have that handy. Do you have another question?
I wasn't able to see the one you just made.
Oh, okay. Huh, weird. Can you see? Oh, maybe it's on, maybe I did it for September. Oh, you can't see it on your profile.
No, I
Oh.
can't see yours.
Yeah.
Sandy's or Ken's.
Okay, gotcha. Yeah, so that might, okay, cool. Thanks for checking that. So she said she just tried to see it on her end for my client, wasn't able to. So looks like we might have gotten our answer, but we're gonna double check on that too. Yes.
For the location, if we put it private, is it like you are the only person able to see that, or is it your team? Is it your agency?
Uh-huh. So if you put location as private, yeah, thanks, Haley. So if you put the location for the client as private, only staff at your agency can see it. Yeah. All right, so I'm gonna go back to my head of households profile. Okay, so next, and so now we see the public alert we just made. So next we're gonna move into status update assessments. So this is essentially what used to be called interim updates. And status update assessments measure the change in the client's status after time in the program. So this is basically just where you're capturing anything that changes for your client since their initial enrollment into your program. So for instance, we'll do an example of this. Let's say that we've been working with Sandy through our street outreach program on an ongoing basis. And let's say that we found out that she has a new income source. So we want to make sure we have the most up-to-date information in HMIS. So we want to make sure and update that client's income. And in HMIS, kind of same standard for this, we have 5 business days to enter any information we learn about the client. So 5 days from knowing that information. So you have a little cushion in there. All right, so your status update assessments are going to live in this programs tab. So basically, like anything that you're editing for a client at the program level is going to live in this programs tab. So I'm going to click back on our programs tab, and then I'm going to find our program enrollment under program history, and we're going to click the pencil next to it. So programs, find your enrollment under program history. and then click the pencil next to it. So now we should be back to this page. So this is basically where you can add additional information at the program level for your clients. So your status update assessments, which used to be called interim updates, live under this assessments tab. So we're going to click on that. And then you're just going to see a general status update assessment. You're also going to see those current living situations where we entered a couple of those before the break today. And then you'll see annual assessments, which we'll get to in a second. So we're going to say this is just a general update for the client. So we would just do this in a status update assessment. So we'll click start next to status update assessment. And then you can toggle on, if you have multiple household members, you can toggle on anyone else you want to enter a status update for. I'm going to toggle off my other household member, Mickey Mouse. I'll toggle him off. So I'm just entering this update for Sandy. And then I'm going to click add status assessment. Your status update assessments, they're going to have the same fields you saw at your enrollment. You're just updating anything if it changes for the client. So for this, all we need to do is scroll down to our income section. And we're going to say that this client has a part-time job. So we're going to toggle on earned income. And then let's say she's receiving about $500 a month and at the part-time job, we'll enter that. And then just basically click anywhere. And if you scroll down, you'll see that it adds the income for you. So really cool, y'all don't have to worry about dates overlapping, changing dates, the HUD verification sections. Y'all don't have to worry about that. It's all just like toggles and entering the amount. So it should be a lot quicker for that kind of thing. So if you did need to update anything else, if they have like a new disability diagnosis, if they have a change in their non-cash benefits, health insurance, anything like that, you would update that the same way. But we'll say that it was just income. So then we'll click save and close in the bottom. And then let's say that we interacted with this client to find out this information. So we would also want to make sure and add a current living situation because we made contact with the client. So we'll click on assessments. And then we'll just add another one of those current living situations. So we'll click start next to current living situation. I'm going to toggle off Mickey Mouse because we only saw Sandy. And then I'll click add current living situation. And we'll enter the date. I meant to make that update for the month, the next month. That's okay. So, but we're going to say we saw them on September 19th. We'll say that they're staying outside. And then we'll put in roughly the zip code where we interacted with the client. And we'll click save and close. We'll click back on assessments. And just want to show, yeah, you also do have files here at the program level. So if you had a file that was specifically attached to a program enrollment, you could add a file here as well at the program level. So I just wanted to show you all that. Oh. So we have a couple more pieces before we go through exit reports, and then we'll have time for questions. Does anyone have any questions about status updates assessments? Okay, I'm excited because they should be a lot easier for all. They used to be like way more complicated. Also, just want to show you some things you can see on the right about your program enrollment when you're in this programs tab. You're able to see the days the client is active in the program, the number of clients associated with that program type, their start date, assigned staff, and then head of household on the right. So you can kind of see some information at a glance there. All right, so next thing we're going to cover before we get into annual assessments and then exit is how to add a new client to an existing program entry. So this is kind of a little bit more complicated in HMIS, and not all of you will run into this situation. So this is more for those of you that work with households, especially if you work with families. If you mostly work with individuals, you shouldn't really have to worry about this very often or ever. Just kind of curious to get a pulse for the room. How many of you typically only work with individual clients? Okay, kind of half. Okay, yeah. So for those of you that raise your hand, you might not have to worry about this very often, but for the rest of you, this might come into play. So basically, what happens if you create a program entry and then you have a new household member that's added? We want to make sure and add that new household member to the existing program entry. So for an example that I use pretty commonly is, let's say that our couple in our household, they have a child that's born. We want to make sure and add the child to an existing program entry. What we don't want to see, and what we see sometimes, is just a child that's on an entry enrollment by themselves. So the first thing that we want to do to add a child to an existing program entry is, first we need to add them to the household. So that's always the first step. And to do that, we have to create the client. So we're going to go through this. So first thing we're wanting to do is adding the child to HMIS. So we're going to click on search, because search equals what? Nice. Okay, so we're going to click on search in the top right-hand corner. And then we're just going to add a child here. So I'm just going to call this baby sponge. So we'll type in baby sponge in the search bar. We'll click search. No one shows up. So you all can name your child, your fictional child, anything you want, your little Clarity baby. So we have them entered here, and then we'll click add client, just like we did at the beginning of training. Click add client. And then it's going to prompt you to enter all the identifying info for the child you just added. So I'm going to create a fake social. And then the date of birth, typically this would be like a future date after the enrollment was created, but we're just going to say that this child was born today. So we're going to type in August 19th, 2025. And once you're done filling out that basic info for the child you just created, we will click add record, just like we did before. It's going to say that the release of information is not entered, so we are going to go ahead and add that, because it won't let us create an enrollment for the child if their ROI is missing. So that's a good feature, in the live side's a little bit annoying for training. So for this ROI, you can just click manage, or you can click on the privacy shield for the child you just created. I'm going to go ahead and click on the privacy shield. I'm going to click add release of information. And then for documentation, I'll click another electronic signature and select e-sign document, and we'll just fill out this ROI for the child. Click save. We'll click save changes. Once you have your ROI entered for the child, we want to navigate back to our head of household. So I know there's kind of a lot of little pieces. Let me know if I'm like moving through anything too quickly. So we have our child created. We're going to click back on the search button to navigate back home. And then we want to enter the name of our head of household. So my head of household is Sandy Squarepants. Cool. Someone had a picture. That's fun. Okay, so I'm going to like Sandy Squarepants. Cool. I don't know who did that, but that's awesome. Thank you. Okay, so then next thing we want to do, we're in our head of households profile. So that's where we need you all to be, is you're on your head of household, you're in their profile tab. Is everybody there? With thumbs up if you're following. And really, if you work with mostly single adults, it's okay if you're not following necessarily. Okay, so now we're going to add the child to our household. That's the first step. That's going to allow us to pull them into the existing enrollment. So I'm going to click manage next to our household tab and our head of households profile. And then we're going to see the child we just added under recent searches. We'll click the plus sign next to the child's name to add them to the household. For member type, I'm going to select daughter. And then start date, we're going to say that the child was born today. So we'll select, keep it that way. And then we'll click save. So now we have the child added to the household. Last piece of this, we're going to then pull the child into our existing program enrollment. So to do this, we want to click back on our programs tab. Again, basically anything you'll do at the program level, you're going to click on that programs tab. And then we're going to click on the pencil next to our program enrollment that we created. And then you're going to see this program group member section on the right. So once you're in your program enrollment at your head of households level, you'll see on the right-hand side, program group members. We're going to click on the plus sign next to program group members. If you hover over that, it says add. We're going to click on that. And then this is where you're going to toggle on the child that you just added to the household. And then you can click enroll. So that's why you always have to add clients to the household first. Otherwise, they won't appear in your enrollment screen. So we'll click enroll. And then it's going to pull us into this enrollment. If they do have a different project start date, you would make sure and edit that, which usually they would. It would be a date after the previous enrollment was created, but it just won't let me travel to the future in here. So I'm just going to quickly fill this out just so that we can move along. So I'm just going to answer all of these fields as no, but you can answer them however you'd like. And then you'll just click save and close. And now you're done. So you may not run into that a ton, but if you do, I just wanted you all to know how to handle that in Clarity. Does anyone have any questions around that before we move on? Yes.
So since the child needs an ROI,
Mm-hmm.
like say the parent did an electronic
Mhm.
ROI like weeks ago,
Mm-hmm.
the parent needs to do a new electronic ROI.
Yeah, so you would just add the child to the head of households ROI, but if there was a previous ROI that was completed just by the parent, you'd want to make sure and complete a new ROI with the child added to it.
Brandy,
Yes.
can you talk about the process for adding a child to an ROI?
Yes, so we might be changing this, but the way we have it now for the electronic ROI, there's not the ability to print anything. So there's only like signature fields and check boxes in the electronic ROI. So basically, whenever you all are completing ROIs for a household, you would need to do that with the physical ROI and upload it. Yeah.
How would you go about inputting a child that is, or a minor that is by themselves? Like we run into like a 15-year-old that's by themselves in a situation.
Yeah, that might be like in like a LifeWorks program or something. Yeah, you can add them to the entry by themselves. Yeah. Yeah, this one's more for like people that are like,
There's no like special designation for someone that's like underage or something like that.
I don't believe so. No. All right. So a couple more things. Y'all are doing great. So next piece, we're going to move into our annual assessments. So these are just for those of you that work with clients for a year or longer. So if you are always working with clients typically for less than a year, you do not need to worry about annual assessments, but I am going to cover it just for those of you that might or that do. So annual assessments are just due annually at the anniversary of the program enrollment date. And you have a 60-day window to complete those. So you can complete those 30 days before the anniversary date or 30 days after. So let's say that we've been working with our client for a year, and we're just going to enter this annual assessment on the date of the anniversary of her program enrollment. So for this client, we enrolled her into our program on August 19th, 2025. She would have an annual assessment due August 19th, 2026. And the annual assessment, this is just updating anything that's changed for your client since their initial enrollment. So it's all the same fields as your enrollment. It's all the same fields as your status update. It's just updating that annually and making sure that everything's up to date. So if you all have really been keeping track with that as you're working with the client, typically you're not even adding anything new. So we're going to complete an annual assessment real quick. So we're in our assessments tab, and you're going to see the one that's labeled annual assessment. So we're at our program level. And just to get back here, if y'all moved around or anything, we click on our programs tab. We find our program enrollment and click the pencil next to it. And that's always going to take you to the screen that looks like this. So I'm going to click back on assessments. And if you've always been there, that's okay. Stay where you're at. So then annual assessment, I'm going to click start next to it. And if you do have multiple household members on your enrollment, you would need to complete annual assessments for each of them. If they have different start dates, it's always according to your head of household enrollment date. So that's always what you're basing your annual assessments around. Just for the sake of training, I'm going to go ahead and toggle these guys off just to make it quick. So I would say toggle your other household members off. Then we'll click add annual assessment. And just for the sake of time, we're going to say that all of this is up to date. We're going to say we're awesome. Case managers, we've been keeping track of all their data. Everything's up to date. So, but in real life, you would want to make sure and go through each of these fields and make sure that nothing has changed. So we'll just scroll down to the bottom and we'll click save and close at the bottom of this annual assessment. Yes.
Toggled all the other ones off.
Uh-huh.
You would actually do it with each one of
Mm-hmm.
them.
Yep, and the system makes it pretty easy. If you are completing annual assessments for a household, it's going to show you the first one. You'll click save and next. It'll show you the next one. Click save and next. So you don't have to find them anywhere. They're just, it's there for you. So yeah, so it makes it easy. Yes, question?
Assessment, will that fall to the same heading? And where will the actual final score end up showing up in the whole profile?
Yeah, so I'm pretty sure we're still building out coordinated assessments, but I think it would be in the assessments tab. I don't know if Sharon knows or anything, or if we're still figuring that out. It's about coordinated assessment and where the coordinated assessment would live, like the APAC.
Live under an agency called Echo Coordinated Entry.
So it's going to live in a separate agency called Echo Coordinated Entry. So yeah, so just so y'all know, this training is not coordinated assessment training, because sometimes you get those, sometimes people think it is the same, which is understandable. But this is just general clarity new user training. There will be coordinated assessment training after we go live, and that's through Sharon Cow. Okay, cool. So now we have our annual assessment completed. So next, last thing before we get into exit and then open the floor for questions are reports. So I'm going to click back on the client profile. And you're going to see this little printer icon in your client profile. These are like very basic client reports. So these aren't ones we're going to cover today, but if you click on client reports, you can basically like run a report to make sure your case notes are in, and you can look at case notes in that report. But the reports we're going to look at for training today are more like the data quality reports, the COC APR reports. So these are reports to look at your data quality. So we're going to click on this little launchpad icon. Yes. No, we haven't done that yet. Okay, so we're going to click on that launchpad, and then we're going to click on reports. I'm just going to run a report, and then we'll do exit while it's running. That's kind of what I was thinking. Okay, so I'm going to click on this reports button. And so this is where all of the reports that you all have access to live. So there's a lot more reports that you all as general users have access to run. So the first one that we're going to run is basically a data quality report. So this is how you can make sure that none of your data is missing for any of the clients you're working with if you want to. So under HUD reports, we're going to click on that drop down. So we're in the report library. We clicked on the HUD reports drop down. And then we're going to find the report that is the HMIS data quality report. You'll see these little stars. If you run a report pretty often, you can click on the star and that will add it to your favorites. And then you can select to either run this now or you can schedule this to run in the future. So I'm going to go ahead and click run, and I'm in the HMIS data quality report. So I'll click run here. And then you'll choose your agency. For the COC filter category, you'll select that drop down and select agency COC. For COC, we're going to select Austin Travis County. For project types, we'll select all. So let me just pause, I might be going fast. So yeah, just selecting your agency, agency COC, Austin Travis County. For project type all. For program status, we're going to click that drop down and select all programs. For continuum project, you can leave that as all. For programs, we'll select all. And then for your date range, I'm just going to run this through the end of September. So I'm going to put August 1st, 2025 to September 30th, 2025. And then you can choose your output format. So you can choose web page, PDF, Excel. I'm going to keep it at web page. And then once you have all those fields typed in, you can select submit at the bottom. And just while this is running, it should run pretty quickly, but while this is running, we're gonna go ahead and exit our client. So that's really crucial. Which, yeah, I think I probably should have exited and then done the report, but that's okay. So we're gonna go back to our head of households profile. So we're gonna click on our search button again. And you're gonna type in your head of household, or you should also see them under recent client searches. So I'm just gonna click on recent client searches. So just navigate back to your head of household. And then last thing that you'll want to make sure to do is exit the client. So the point at which you would exit a client is when you're no longer providing services for that client. And especially for street outreach programs, if you have not had contact with a client for 90 days, we want to exit them. Cool thing about Clarity is the auto exit feature. So it's not something that you all have to track on your end anymore. We have the auto exit feature. But if you know you're not going to be working with this client or providing services for them anymore, you can exit them. So again, we want to click on the programs tab. Yes. Oh, oh, fun.
I just want to make sure I heard this correctly. Our clients will be auto closed after 90 days. Don't have to track any stuff.
That's right, right?
No.
No?
That's what I was gonna speak up about. So the auto exit will say that a exit interview is not complete, which is also a negative exit. So it is best practice to exit that client yourself, because that does count against you data quality wise. It also is a negative exit for us for the system performance measures, these reports that go to HUD, that gets us more money from federal, that helps us to, so we want those exits to be done. The reason why we turn that on is because we have thousands of records in our current HMIS that don't have any exits. So this is just like a safety feature for when those exits don't happen.
All right.
But it is 90 days.
Thanks for clarifying that. So yeah, if you know you're no longer providing services for the client and working with them any longer, it's best for us to exit them. So basically, so that you can give the correct destination of where the client's exiting to, if you know that. But basically, the system will catch it if you lose track of a client, essentially. Okay, so we're going to exit this client. So we're going to click on our programs tab again under our head of household. And then we're going to click the pencil next to the enrollment we created. And then we're going to click on this exit button. So you're going to see this exit button to the right of all of your tabs. So I'm going to click exit here. And then we will go ahead and exit all of the household members. And then we're going to click end program. And your exit assessment is essentially, again, all of the same fields as your enrollment, as your status updates, as your annual assessments. It's just double checking all of this is still true at exit if you're able to. And the additional field is your destination. So where is this person exiting to after they're no longer working with your program? So we're going to create a project exit date, and that should be after the annual assessment we created. So I'm just going to set this for like January 2027. Just to be safe. So we'll say we're exiting this client January 2027. Destination. So this is where we're indicating where the client is exiting to. So is the client exiting back into homelessness? Are they exiting into an institutional setting? Are they exiting into housing? Whatever the case may be. If you don't know where they're exiting to, maybe you weren't able to complete an exit interview, you can select no exit interview completed. Or if these options, there are a lot of options, but if those don't capture where the client exited to, you can put in other and write in where they exited to. I'm going to say that this client is exiting into housing. We're going to say that they were picked up by like a rapid rehousing program. So I'm going to choose a housing option. Well, you're going to say rental by client with ongoing housing subsidy. And then for rental subsidy type, I'm going to choose rapid rehousing or equivalent subsidy. And then we would go through this information and we would update anything that changed for the client exit if we're able to. And if not, we would leave things the same. So I'm going to scroll down. You'll click save and next if you have other household members attached. If not, you'll just save and close. We have a couple other household members, so I'm going to do the same and enter where they're exiting to. And I'm just going to put in the same exit destination for each of them. So yeah, it makes it really easy for you to exit multiple members of a household because it will just take you directly to the next exit. So this was our last household member here. This is Baby Sponge. So we're going to click save and close. And so that's the last piece, is exiting the client. So basically, first thing you're going to want to do is create your enrollment. As things change, status updates, make sure you're entering those current living situations when you make contact with your clients. And then the last piece is exiting them. And yes, question? Yes. That's a great question. I think so. Winnie?
Yeah, I mean, I would absolutely keep track of things. Your staff's caseload. As you can see, there's numerous reports that we use to track those things, and we'll be monitoring those and sending out kind of details of what those reports can be used for. That's also not a feature we're going to turn on right off the bat. So the 90 days, that's not going to be there. That's not going to be utilized right away. But yeah, please go ahead and just best practices to
Okay, so next we're going to take a look at the report we ran earlier to see what that looks like. So whenever you do run a report, you'll see it up in your report queue at the top, and it will say completed once that's done running. So we're just going to click open. So if you did create that report with me, you'll see a little report queue up in the top right. Click on it. It's going to say completed. Now we can click open to look at this report. So this is going to show you total number of people served in the program. And this is just the training site. So this is not live client data. It's just what has been entered in our training site. So total number of people served in the program. You're going to see number of veterans, number of chronically homeless individuals. And then if we scroll down, you'll see these data quality sections. So this is where you can really check and see if any information is missing for your client that needs to be corrected. So you'll have name, social, date of birth, all those universal data elements. And then if we do see anything missing, so we have a couple of folks that maybe don't know social, which is fine, but you can kind of investigate by clicking on that number. It will open up a new window, and then you can see which clients are maybe missing a social. And we have this for veteran status, project start date, relationship to head of household. You can see timeliness of data. So I'm just kind of scrolling through that. So that's basically a very basic kind of data quality report. We'll run one more report, but I want to make sure we have time for